Welcome. Right now, the world is being swept by a deadly Ebola outbreak. It has already claimed dozens of lives and it rages on. In this short video, you will learn everything you need to know about the Ebola virus and the preventive measures that you can take. Ebola is classified as a level 4 biohazard, regarded as the most dangerous and requiring decontamination of those who work with the virus. The virus itself has got 5 strains, each strain named after a country or a region in Africa. So we've got the Zaire strain, the Sudan strain, the Thai forest strain, Bundibugyo strain, and Reston. The Zaire Ebola virus is the deadliest of these 5, with a mortality rate of about 25 to 88% depending upon how well the virus is contained. Just how deadly this virus is can be gauged from the fact that during this current outbreak, around 70% of all those who have contracted Ebola have died. It is believed that fruit bats may be one of the hosts, and it is also known to be present in monkeys and apes. It is suspected that primates or monkeys are first infected by the virus after eating fruit that has been tainted with urine or other bat fluids. Um, the symptoms of Ebola can be, well, extremely nasty. Ebola generally starts with a rapidly rising fever, intense feeling of weakness, a lot of muscle pain, headache, and a sore throat. This is then followed by vomiting, diarrhea, rashes on your body, kidney and liver problems, and then eventually to bleeding and hemorrhaging. It is this hemorrhaging that gives Ebola the reputation of a flesh eating virus, though in reality it is not eating flesh but destroying living tissue cells. As discussed earlier during the video, Ebola starts off as a viral strain in animals, who then infect humans. Humans don't carry the strain itself. However, once infected, Ebola is transferred from one person to another through contact with the blood or secretions of other bodily fluids of the infected people, including but not limited to sexual intercourse. Well, unfortunately, there are no drugs that are scientifically proven to work against the disease. So, as far as we are concerned, Ebola right now cannot be treated. The only drug that well claims to work against the disease is an experimental drug called Zima. But apart from that, there is no other known vaccine. So, without a proper vaccine, treatment for Ebola right now revolves around therapy using blood plasma from people who have recovered from the disease, anticoagulant agents which attempt to reduce the hemorrhaging a patient is suffering. But the most effective way to reduce or to prevent the transmission in an outbreak sort of a scenario is through proper use of barrier protection. So, gloves and face masks are pretty much your one and only defense against this absolutely deadly virus. Well, now you know everything you need to know about the Ebola virus. Stay safe and do not forget to subscribe.